Hello everyone, this is Inge Stoffels from Cape Town, South Africa. Cyril Ramaphosa had a weekend-long campaign trail in KwaZulu-Natal and he spent the weekend visiting residents of Greytown and ending off the day in Ashdown Township addressing the ANC supporters. Now, during this campaign, he faced a brief disruption from community healthcare workers in Pietermaritzburg. Now, these workers were workers who are earning about 4,000 Rand per month without benefits. That means no pension, no medical aid, no benefits. They are asking for a meeting with Ramaphosa before the 29th of May elections. Now, the community healthcare workers are demanding permanent employment and better pay before elections. They voiced this in a mini protest during Cyril Ramaphosa's election campaign.
Healthcare is a basic human right, not a privilege. We have thousands of healthcare workers unemployed, 800 medical doctors still unemployed, and thousands more professional nurses, physios, dietitians, and the list goes on. But stick around. I want you to meet a few people.
I'm a doctor in South Africa. Of course, we're still unemployed.
I'm a professional nurse in South Africa. Of course, we are the backbone of the healthcare system, but we are unemployed.
I'm a physiotherapist in South Africa. Of course, there's 300 plus of us unemployed.
I'm a doctor in South Africa. I studied for 6 years and did 3 years of training, but I still can't serve the people in South Africa.
I'm a South African community service doctor. Of course, I fear being unemployed next year.
As it stands, there's one doctor for every 3,000 patients in South Africa and one nurse for every 218 patients.
I'm a public patient. And of course, I've waited 7 hours to get help.
I am a doctor in South Africa. Of course, we want to serve our people.
I am a patient in public. Of course, I had an emergency, but only saw a doctor 5 hours later.
Let's give our people the quality health care they deserve.
Now, these workers are employed on a contractual basis and their agreements last 12 months, 1 year. And this leaves them with no job security. President Cyril Ramaphosa did not address their concerns, but he went on to emphasize the ANC's commitment to job creation. He then also highlighted the recently signed National Health Insurance Bill, which aims to provide fair healthcare access to all South Africans. Now, these healthcare workers, this is their concern. You know, I've studied, this is what I want to do, but we are left with no job security. We are being paid the bare minimum. We do not have any benefits. When are we going to see the change? Instead of hearing the promises, they want to see the change. Here is what some of the posters had to say in this mini protest. Posters saying, President Ramaphosa, we need a meeting with you regarding community healthcare workers. President, can you survive on 4,000 Rand per month when you are absorbing healthcare workers? And these were some of the signs. So they outcried, they're crying out for help because as we saw during the pandemic, healthcare workers are essential. They were essential workers. And why are we not treating them this way? Why are we not taking care of them as they are taking care of the community? This is community healthcare workers. So they are demanding a meeting with the president before the elections and to discuss a plan to move to make their positions permanent. And this is a statement that Cyril Ramaphosa, this is something that he had mentioned. He says, as we speak, and this was also with regards to the NHI bill, the National Health Insurance Bill that was recently signed. He says, as we speak, our people are not able to access quality health care because when they are unwell and want to seek medical assistance, they are asked to pay a fortune. As things stand, only the rich can access quality health care. And to us as the ANC, that is unacceptable. Now, many people saying, at the moment, he's focused on the wrong thing, focusing on something good, but for the time being, there are other things that need his urgent attention. But what are your thoughts on this topic? Let us know in the comment section below.